Diabetes has become a common household term. For at least 20 years, the diabetes rate in North America has been increasing substantially. According to the United States Center for Disease Control and Prevention, or the CDC, the prevalence of diabetes in the United States has become an epidemic. In 2010, the CDC reported that nearly 26 million people in the USA were estimated to have diabetes, and about 7 million of those are undiagnosed. The National Health and Nutrition Examination Survey found that 18 to 20% of adults 65 and older have diabetes, and up to 40% are estimated to have prediabetes, or its precursor, impaired glucose intolerance. According to the CDC, it is projected that as many as 1 in 3 adult citizens of the U.S. could have diabetes by 2050. Several trends are noted by the CDC that explains the rising numbers. A large segment of the population is aging, and many people are living longer with diabetes due to improved management of the disease. Therefore, the total number of people living with diabetes is increasing. Further advances in pre-screening have increased the reportable number of prediabetes cases. The organ that is chiefly responsible for production of insulin is the pancreas. It is located deep in the abdomen, sandwiched between the stomach and the spine. Scattered throughout the pancreas are regions called the islets of Langerhans that produce several types of hormone-producing cells. The key to understanding blood sugar control is to understand the role played by these special cells. One such type of cell is the beta cell. The beta cells within the islets of Langerhans are responsible for insulin production. The job of the beta cells is to produce, store, and release insulin into the bloodstream at appropriate times. Another type of cells produced in the islets of Langerhans is the alpha cell. Alpha cells of the pancreas release glucagon. Glucagon is a hormone that stimulates the liver to convert stored glycogen into glucose when plasma glucose is very low. Maintaining a steady supply of insulin is important. It allows the cells of the body to utilize blood sugar even if some time has passed since a meal. For example, the beta cells of a healthy person who has not eaten recently would still release small amounts of insulin into the bloodstream throughout the day and night in the form of very small pulses every few minutes. This is called basal insulin release. In contrast, a diabetic person who has skipped a meal and not eaten in a while will risk hypoglycemic or low blood sugar effects. This triggers hunger and may cause one to eat more, which can have the reverse effect, causing hyperglycemia or high blood sugar. Maintaining steady blood sugar levels is necessary for individuals with diabetes. The various causes and effects will be discussed later in this course.